Kentucky is the first state to approve work requirements for Medicaid recipients. Now, here's what Pour No More author Peter Cove had to say about that. Roll tape. Suppose, just suppose, a hypothetical, you're a mother, you've got 3 children, you've got to stay home to take care of those kids, and you are a single mother, single parent. You get Medicaid. Would you be kicked off? Because you really can't go get a job when you've got 3 kids at home.
As long as daycare is available, and daycare generally is available. So if daycare is available, she should be able to go to work. That is what we did in 1996, and that's why the rolls went down, and people went to work, and no one went starving.
All right. Joining us now, someone who knows all about this, Star Parker, founder and president of the Center for Urban Renewal and Education. Are you okay with those safeguards for single parents who do have to look after young children and would find it very difficult to get a job or part-time or training for a job?
Well, one of the things that these lax rules are allowing for the states to do is be ingenuitive. So what that does is allows for moms like that one, particular in your hypothetical, to actually open a daycare if that's what she needs to do to get to work. What is happening here, Varney, is that under the Trump administration with the GOP leadership in the Congress, we're starting to see a much more flexibility in the rules that govern over the states so that they can start trying new experiments to really help people get their dignity, help people get work experience, help people get good health. So through the Centers for Medicare and Medicaid Services, we're starting to see a little lax, and this is where the great governor of Kentucky, Matt Bevin, said, let me take advantage of this new opportunity to try to see if we can include work and training and other mechanisms so that people will move from sitting on their couch as they're getting their Medicaid and maybe start getting more involved and participating in their own lives and in our society.
Well, Star, does this amount to wholesale welfare reform? Bill Clinton brought us that in the 1990s, and it worked in the sense that it reduced the rolls on welfare. Is this the equivalent? Is this as big a deal?
Well, it might even be a bigger deal, because when you start thinking about our anti-poverty programs run out of Washington, D.C., they're about $900 billion a year, a quarter of the budget. So Medicaid is a significant part of that. It's probably a little more than half of that. And Medicaid is a program, anti-poverty program, that is shared expenses with the states. So they are also contributing in this. So yes, of course, it's touching welfare reform, but it's a necessary touch, because when people are in good health, they feel better about themselves. When people work, they feel better about themselves too. So to combine these two elements in the different states, allowing for them to make changes where they need to, is a good idea. It's healthy for the discussions that will come even on welfare reform, which we will get to very soon here.
Star, when I introduced you, I said, you know what you're talking about here. I think I should let our viewers know that you were once on welfare. I'm not going to say you were a welfare queen, but you came pretty close, didn't you?
Well, I took advantage of the system, that's for sure.
You played the system. Now, when you got off the system, out of the system, and you were working, how do you feel?
Well, of course you feel much better about work, but it is very risky. But here's the real issue at hand. You're absolutely right, Barney. I was on welfare over 30 years ago, and nothing has changed since then. We're able to just do whatever you want to do. There's little requirement for people to get back to society. There's little requirement for the folks that are sitting there taking advantage of somebody else's work. So this is a good move to start getting much more creative about how we distribute anti-poverty monies, tax monies, to the states for them then to help those that are most vulnerable. One thing that we can surely do to help the most vulnerable in all of our distressed zip codes is allow them to participate in their own lives. And that's what they're doing in Kentucky and many other states across the country now that these laws have been laxed.
All right, Parker, since you call me Varney, I'll call you Parker.
Well, that's your show, Varney, and Happy New Year.
Oh, and to you too. Parker, I do think you're all right, and I do hope you come back on the show real soon. Thanks.
I will. I missed you.
Thank you very much.